Hello, I'm Dr. Alicia Power.
And I'm Dr. Maria Kang, and welcome to Growing Healthy,
a podcast about pregnancy, pediatrics, and beyond. Skin is the biggest organ in our body, and we need to take care of it. We do this with eating healthy food, drinking lots of water, and by what we put on it. Today's podcast is going to be about the basics of skincare. We will get to that right after this quick reminder.
The Growing Healthy podcast and website is meant for general medical information only. This does not apply to every situation, and should you have questions or if you have received different advice, please contact your healthcare provider.
The views expressed by Growing Healthy and our guests are not representative of any institution with which you are affiliated. Welcome to Skincare 101. We're going to talk about the basics. We're not going to get into all the big fancy stuff. But if you can manage this, you are in a good place. Obviously, everyone has different skin types and needs, so there may be a bit of trial and error depending on your skin type. And if you have any complicating factors like eczema or acne, we will give you a few suggestions of products in each area and put links in the show notes if you're interested. Okay, let's start by talking about basic skincare regime. Alicia?
So first of all, we want to give a big shout out to a doctor in Calgary. She's an emergency physician, and she has a interest in skincare. She's done some extra training in it, and her website is aishamd.com. So she gave us permission to use a lot of the information off of that for this podcast. So thank you very much. So let's start off. Your morning regime or regimen should start off with a mild cleanser. Now, we want to use one that's not too drying. So a lot of the soaps are very drying on our skin. So we recommend something like the CereVe, Cetaphil, or Neutrogena emollient-based cleansers. This is not the time that you want to do your exfoliation. We're going to save that till the evening. So after you cleanse your skin, next you want to put on a moisturizer. During the day, you probably want a light one so it kind of goes on and absorbs quickly and isn't goopy for the rest of the day. After that, you're going to apply your sunscreen, and we'll go into a little bit more detail about later. And then if you choose to, then you'd put your makeup on. In terms of choosing a makeup, if you want a little bit more protection from sun and environmental factors, you're going to choose a mineral-based powder makeup, and that'll provide you with a little bit more of that protection.
Now, it's the end of the day. Thank goodness. You want to use a makeup remover if you wear makeup. And then you want to cleanse all the dirt of the day off your face. This is the time that you can add in some mechanical exfoliation, like a washcloth. That's a good idea, to gently scrub some of the extra skin cells off. But be careful under the eyes, because that's a pretty sensitive area and very thin skin there. You can also use skin cleansing brush. This is the mechanical exfoliation. There's all sorts of products out there in terms of that. Then you want to apply your moisturizer, and this should be a bit thicker, especially in areas that you have drier patches. And also more moisturizing for overnight. So you want to gently dab this thicker moisturizer under the eyes in particular, so as not to damage the skin as well. Some people do choose a chemical exfoliation like fruit acids. I think the newest fad is lactic acid or similar products. This is also fine. It can be a little harsher on the skin, so probably only 1 to 2 times a week is plenty enough.
In terms of that 1 to 2 times a week, the other product that some people are starting to use is a retinoid product. And again, we'll go into a bit more detail about this later, but this would be another option that you could use 1 or 2 times a week. Some people use it nightly, so it would be the evening routine that you would add this in. You do not want to use the retinoid at the same time as the chemical exfoliation, such as the fruit acids, because that would be too much for your poor skin to bear. So, well, that's it. That's your basic skincare regime. It's not too tough. Pretty simple, right?
I think it's actually really nice. At the end of the day, you have your regimen. Hopefully the kids are kind of asleep. And then you get some time for yourself. I think it's a nice thing to do.
Yeah, and when you're putting on that moisturizer, give yourself a little face massage, or maybe convince somebody else to do it for you. So for the rest of your body, same idea. You want to use an emollient-based skin cleanser, similar to previous, as we said, the CereVe, Cetaphil, or the Neutrogena, because you don't want to strip all those really good, healthy oils off of your out of your skin, because that leads to more drying of your skins. And especially for washing your hands during the day. Some of us have to wash our hands a lot during the day. So you want to be gentle on your hands. So again, having those next to your sinks that you're using frequently at work or at home is a really great idea. And then also having next to them a good moisturizer to put on. You should be using that once or twice a day on your entire body. And then especially if you're prone to kind of eczema or dry skin, you want to be applying it almost every time you wash your hands.
This advice regarding care of your body skin also applies to babies and kids. Use gentle emollient base cleansers and good thick moisturizers. And I love that thick. I mean, when you're testing it out, you want to put it between your fingers, see what's thicker, because that's going to stay longer. And this helps maintain the integrity and function of their little skin. Okay, so that's the general sort of skincare tips. Let's get into the nitty-gritty, Alicia.
So sunscreen. I'm a big fan of sunscreen. As you guys all know, I'm a family doctor, and I have a lot of people coming into my office wondering about moles and changes in their moles, and is this skin cancer? Well, you know what? One of the most important things we can do is help protect our skin to prevent those skin changes, both dangerous and cosmetic, down the way. So sunscreen is one of the ways that we can do this. So it's very helpful in preventing the damage that's caused by the ultraviolet light in our skin. Now, a quick lesson in ultraviolet light. There are two different types. We have UVA, ultraviolet light. These are longer wavelengths, and they actually go deeper in the skin. And these are the ones that can cause premature aging. So those sunspot, those wrinkles, those are kind of the things that are caused by UVA light. UVB wavelengths are shorter, and they tend to cause more of the sunburns, although both can actually cause sunburns and kind of the skin cancers. But again, both can cause skin cancers. And the UVB lights are what we make vitamin D from. Now, for those people out there who say, well, if I use sunscreen, I won't create my vitamin D. It actually only takes about 5 minutes of sun exposure with shorts and a t-shirt on, particularly in fair-skinned people, to get the vitamin D that you need. So it's really not a lot of time that we need to expose ourselves to sun for that vitamin D. Like I said, both UVA and UVB wavelengths can cause skin cancer. And so for these reasons, we should use a sunscreen every day on those parts of your skin that are exposed. Now, some people choose to cover their skin with long sleeve shirts and long pants and wide brimmed hats, and I think that that's a great thing. But a lot of us can't kind of cover everything up. So for day-to-day use, we want to use an SPF of at least 30, and that's probably fine. But if you know you're going to be spending more time in the sun, an SPF of 60 is better. Now, most of us don't apply it properly, and so that's why we need a higher level than if you actually did the math in terms of what you should be using. So in terms of choosing a sunscreen, like I said, you want one that covers both UVA and UVB rays. If you have dry skin, you want to choose one that's more of a cream or ointment base, that thick in your fingers like Maria was talking about in terms of the moisturizer. If you have oily skin or acne-prone skin, you want to choose one that has more of an alcohol-based lotion, gel, or spray.
You may have heard in the news about certain sunscreen products that cause significant irritation, maybe even burning to babies' skin as well as people with sensitive skin. So this is a great reminder for you to always test the sunscreen on a patch of your skin before you lather it all over, in particular when you're choosing a sunscreen for your face.
That's a really great idea. In fact, my son has eczema, which we're going to talk about in another podcast. And there's certain brands that I can use on his skin and certain brands I can't. One, because they cause more irritation of the eczema, and two, because they actually are sore when I put them on his poor little skin. So great idea to do a patch test on adults, but especially on kids and babies. Now, when talking about babies, we have to remember that really we shouldn't be using much sunscreen in the first year of life. You really want to cover them up with SPF protective suits and wide-brimmed hats. If there's small areas like a nose or toes that are coming out, you want to use more of a barrier-based sunscreen, such as a zinc oxide on those areas.
Remember, the more zinc it has, actually, the longer it stays. It's the thick, pasty stuff. You'll remember like diaper cream.
And you can get it in some amazing colors. Pink, blue, super awesome. So in terms of applying sunscreen, I kind of mentioned this a little bit earlier. We do not do this properly. We use way less when we should. So when you are applying, apply liberally. You should feel a film on your skin where the sunscreen was applied, and you need to give it time to work. So you want to apply it about 30 minutes prior to going out in the sun and reapply it every 2 hours if you're going to be staying out there. Also, even if it's waterproof, you want to reapply after swimming, excessive sweating, or if you happen to wipe it off with a towel, etc.
You know, I remember in university we did this experiment. I think it was chemistry or something, and you put different layers on top of the UVA and UVB light, and then so we tested it afterwards. Anyways, it was amazing how thick that layer had to be in order to actually not seep through, not absorb through. And it's always a good reminder for me, more is actually probably better in this scenario. Just being very liberal, as you said, Alicia, with the sunscreen.
And I may be making this up because I do tend to make some stuffs up sometimes, but I feel like I read somewhere that the vast majority of skin damage, i.e. leading to cancers, happens in the first few years of our lives. So our kids' skin is extremely sensitive, and so we really need to be very cautious in how we expose it to the sun. Does that make sense to you, Maria, or do you think I made that up?
No, I think you're very right. And it also depends on sort of your natural risk factors as well, right? Our lovely fair-skinned babies are probably more at risk for those changes in their skin. And so, I always remind people, use your best judgment. There's such great barrier clothes now. I mean, they're cute little swimsuits. There really is no other reason to not protect your baby's skin, especially in that first year of life.
Great. So we're going to move on to retinoids. I briefly mentioned these earlier. Now, retinoids are a topic that I am starting to use a lot as my skin is starting to age.
No.
Yeah, I know. It's sad. I'm 29 and it's getting so old. So retinoids, for those of you who don't know, they're a topical substance. So they're a vitamin A-based topical substance that are gently applied a couple times a week to daily. And we use it to treat acne, but we can also use it to help reduce some of the damage of sun that goes on with aging. So we're talking kind of wrinkles and sunspots here. So it's a field-based treatment is what we call it. So you don't use it on the one spot. You apply it to your entire face. Some people use it on their kind of neck and upper chest as well, or the tops of their hands where you notice there's often sun damage.
Décolletage.
Your décolletage. Okay. So certainly when you are using retinoids for acne, it takes about 6 weeks to notice a difference. And that is a very good rule of thumb for most medications that you start for anything. It takes time to notice if there's a difference. But certainly for acne, for any medications we use to treat acne, it takes about 6 weeks to really know if it's making a difference or not. And in terms of the sun damage skin, it needs to be used over a long period of time. So you're not going to use it for a week or two. This is kind of a lifelong type use that you're going to kind of continue to maintain and prevent further damage. Now, when I say prevent further damage, I mean it helps take off that top layer of skin. So when the sun damages that skin, it can help kind of renew the under coatings of the skin. But by doing that, it's also increasing your risk of your skin getting damaged. So it's so important to make sure that you're using a really good sunscreen if you are using a retinoid product. And that applies for people using it for acne or people using it for sun damaged skin. It can be quite irritating. I don't know if you've ever used a retinoid, Maria.
I have. I don't have sensitive skin on my face necessarily. I could feel the tingle.
Yeah. And so I have as well. And my skin's a little bit sensitive, so I certainly had to ease into it a little bit. So we usually recommend, especially for those people with sensitive skin, starting off applying it very sparingly, leaving it on for an hour, and then taking it off. And then you can slowly work your way up. So you'd start with a lower dose retinoid, apply it, leave it on for an hour. You could do that probably a couple of times a week and then move up to daily if you wanted to. And then you can start leaving it on for longer and longer periods, i.e. overnight. And then once your skin is used to that, you could step it up to a bit of a higher dose if you want, or just use the dose that your skin is used to. And it's different for everybody. Some people do have a severe reaction to them, and that means that your skin is just too sensitive for them and you're probably unable to use it or need to use a really, really low dose, which we can find there's some retinoids in drugstore products, and so we can certainly use those, and those are at a pretty low dose. If you want a stronger product, then that's generally a prescription-based product you can get from your family doctor or from your dermatologist. Just a note, we do not recommend topical retinoids in pregnancy or breastfeeding. There's probably not a huge amount of absorption, but we do know that vitamin A can cause significant birth defects in babies, and so I think it's best to avoid it altogether during that time that you are pregnant and breastfeeding. Well, Maria, I think that is about it for our general recommendations. Do you want to talk a little bit about some products that we found to be useful in different types of skins?
Absolutely. And I will say that some of these products, whether it's a moisturizer or a cleanser or sunscreen, the costs vary. And, that's always something to keep in mind as well, that the cheaper products may cause a little bit more irritation just because they're targeted for a more general population. So unfortunately, what I find at least is, the good stuff does tend to cost a little bit more. But in any case, so sunscreen for oily skin. So there's Cetaphil Oil Control, CereVe Moisturizing Lotion, La Roche Posay. I don't actually know how to say that. Anthelios.
I use this one. It's great. And an SPF of 60.
Nice. And Skinceuticals, Physical Matte Defense. That would probably be for your face. And then Rodan and Fields Reverse, speaking of pricey products.
And those ones are generally sold by individuals. They're not, you can't find them in the pharmacy or anything. So the other ones are certainly all great options, but some people need a bit more of a sensitive type product. And those Rodan and Fields are cruelty free as well. So some people like that option as well.
Okay, sunscreen for dry skin, Neutrogena Healthy Defense, Aveeno Positively Radiant. I've tried that one. That's quite good. La Roche again, Posay Anthelios, and the Skinceuticals Physical Defense. And I am going to say that, again, the cost will vary here. So you really want to look at that price point and look at that SPF and make that decision for yourself.
Well, I think that's about it for our talk today, Maria. We will make sure that we post all of the links to those products if people are interested on our show notes. And certainly if you have any comments or questions, then you can post them on our site. And if we're able to, we will incorporate them into future podcasts or come up with another podcast based on those.
Great.
Well, keep on growing healthy.